Upbeat, informative intro music fades into the background. Hello, and welcome back to our channel. Today, we're tackling a topic that's incredibly important for global health. Malaria. This disease, caused by a tiny parasite spread through mosquito bites, can be serious, but the good news is that with the right knowledge and timely action, it's treatable. So, let's dive into the essential guide on how to manage and treat malaria effectively. First things first. What exactly is malaria? It's an illness caused by a parasite called Plasmodium. When an infected mosquito bites you, it injects these parasites into your bloodstream. They then travel to your liver, where they mature and multiply. After a while, they re-enter the bloodstream and start infecting red blood cells. This is when the classic symptoms of malaria, like high fever, chills, and flu-like illness, usually begin. If it's not treated quickly, malaria can escalate and become life-threatening, which is why early diagnosis and treatment are absolutely critical. So, you're feeling unwell, and you suspect it might be malaria. What's the first step? The most crucial thing is to get a proper diagnosis. You should never, ever self-diagnose or start taking medicine without confirmation. Head to a doctor or clinic immediately. They will perform a blood test to check for the malaria parasite. There are two main types of tests. The malaria parasite test, which involves looking at a blood smear under a microscope, and the rapid diagnostic test, or RDT, which gives you results much faster. A confirmed diagnosis is the starting line for effective treatment. It tells the doctor not only if you have malaria, but sometimes which type, which helps him choose the best medicine for you. Once malaria is confirmed, your doctor will prescribe antimalarial medicines. The specific drug you get depends on a few factors like the type of malaria parasite, you have the severity of your symptoms, and where in the world you got infected, as some regions have parasites that are resistant to certain drugs. For most cases of uncomplicated malaria, the most effective and widely recommended treatment is something called Artemisinin-based Combination Therapy, or ACT. You might see names like Artemether-Lumefantrine or Artesunate-Amodiaquine on your prescription. These are powerful combinations that work fast to clear the parasite from your blood. In the past, a drug called Chloroquine was very common, but unfortunately, many malaria parasites have become resistant to it, so it's only used in the few remaining areas where it's still effective. Now, what about severe malaria? This is a medical emergency. Severe malaria, often caused by the Plasmodium falciparum parasite, can lead to serious complications. In these cases, treatment is much more intense. The first-line treatment is usually intravenous. Artesunate, given directly into a vein. This allows the medicine to work as quickly as possible to bring the parasite load down. Once the patient is stable and can take medication by mouth, they're typically switched to a full course of an oral act to completely clear the infection. Alongside the powerful antimalarial drugs, supportive care is a huge part of the treatment plan. This is all about managing the symptoms and keeping the body strong while the medicines do their job. For example, a high fever is a hallmark of malaria, so your doctor will likely recommend Paracetamol to help bring your temperature down and make you feel more comfortable. Staying hydrated is also key. If you're vomiting or too weak to drink, you might be given intravenous or fluids to prevent dehydration. In very severe cases where malaria has destroyed a lot of red blood cells, a patient might develop severe anemia. In this situation, a blood transfusion might be necessary to restore their red blood cell count. Why is all this so important? Because early and correct treatment is the best way to prevent severe complications. When malaria is left untreated, it can lead to devastating consequences like cerebral malaria, where the parasite affects the brain, as well as kidney failure, severe anemia, and sadly, it can even be fatal. Following your doctor's instructions precisely is your best defense against these outcomes. Of course, the best way to deal with malaria is to not get it in the first place. Prevention is always better than cure. If you live in or are traveling to an area where malaria is common, there are several steps you can take to protect yourself. The most effective method is sleeping under an insecticide-treated mosquito net every single night. These nets create a physical barrier, and the insecticide on them repels or kills mosquitoes. When you're awake, especially during dawn and dusk, when mosquitoes are most active, use a good quality mosquito repellent on your exposed skin. Wearing long-sleeve shirts and long pants can also provide an extra layer of protection. Around your home, make sure to get rid of any stagnant water. Puddles, old tires, or pots collecting rainwater are perfect breeding grounds for mosquitoes. Draining them can significantly reduce the mosquito population in your area. For travelers heading to high-risk zones, your doctor might recommend taking preventive medicines, known as prophylaxis. You typically start taking these pills before your trip, continue during your stay, and for a short period after you return. This isn't a vaccine, but it provides a very high level of protection. Let's wrap up with the most important take-home message. Never self-medicate for malaria. If you have a fever and think it could be malaria, see a doctor. Get a blood test. If it's positive, take the exact medicine your doctor prescribes. And this is crucial. Complete the entire course. Even if you start feeling better after a day or two, you must finish all the pills to ensure every last parasite is cleared from your body. Stopping early can lead to a relapse and can also contribute to the development of drug-resistant malaria, which is a growing problem worldwide. We hope this guide has been helpful and empowering. Understanding how malaria is diagnosed and treated is the first step in fighting it effectively. Stay safe, stay informed, and always seek professional medical advice. Thank you so much for watching. If you found this video valuable, please give it a thumbs up. And don't forget to subscribe to our channel and hit that notification bell so you won't miss our future health guides. See you in the next video.